Good evening and thanks so much for joining us. I'm Jennifer Abney.
And I'm Rob Macco. West Virginia is now one of the top states with the fastest growing rate of COVID-19 infection.
In fact, today West Virginia House members had a chance to question the governor's COVID-19 task force. 13 News reporter Larissa Casillas has the story.
How to safely reopen West Virginia's schools is what House members from the Health and Human Resources Committee say their constituents want answered the most.
I was hoping to see Clayton Burge. So my constituents had a lot of concern about school reentry and what it's going to look like and how we protect both the staff, the teachers, and the students.
Although a representative from the State Board of Education was absent from Monday's meeting, other members of the governor's COVID-19 task force were there to take questions. West Virginia National Guard Adjutant General James Hoyer told House members the state won't be relying on other countries for their PPE, as the National Guard is currently working with West Virginia University and prison inmates to create their own. Dr. Anjay Anjad, a newly appointed state health officer, was also there. And she says while the pandemic has been going on, depression rates are going up, and the state is still suffering from opioid overdoses.
The meeting had about 50% attendance, and while most of the delegates were here to pose their constituents questions, they were also here to advocate for more transparency and collaboration.
Unfortunately, there hasn't been a lot of communication between the legislative branch, which is closest to the people, and the executive branch and the governor's office.
Delegate Michael Pushkin says he wants more financial accountability, saying Governor Justice doesn't have the constitutional authority to allocate public funds like the $1.2 billion the state received in CARES Act money.
I think it's really important that we work together. There's 100 members of the House and 34 members of the Senate and a governor, and so far the governor has done everything with his executive order, and I like being involved in the decision-making process.
In Charleston, Larissa Casillas, 13 News, working for you.
House members also asked about more testing in African-American communities, privacy concerns over contact tracing, and reimbursing local health departments and people who have to pay out of pocket for private COVID testing.